It is the rarest form of breast cancer, but very aggressive and oftentimes misdiagnosed. Unlike other types of breast cancer, inflammatory breast cancer can be difficult to detect by an ultrasound or a mammogram. And Dr. Simeon Jaggernauth of Cancer Treatment Centers of America, he's here with breast cancer patient Glenda Battle. How are you two?
Fine.
Great, thanks.
Good for you to be here right now. Dr. Jaggernauth, explain exactly what this inflammatory breast cancer is and why is this so dangerous?
Okay. Well, inflammatory breast cancer is a rare form of breast cancer that most women don't really know about. Less than 5% of cases are usually found in women who are diagnosed with the disease. What's unusual about this is that there is usually not a lump. Nothing, not even a mammogram will detect it at all. It usually is found when the woman sees an abnormal spot on the breast. It looks red, looks irritated, looks very unusual in appearance. And we're not really sure why this develops, but we know that if it's not addressed quickly, it can lead to serious complications.
Are there any other symptoms besides maybe or maybe not seeing this redness or irritation?
Well, typically what would happen is that there would be a development of what's called a peau d'orange, a dimpling of the breast. It looks like an orange peel. Okay. So the orange peel appearance, the nipple will go from a normal appearance to what's called a retracted appearance. Okay. This would then lead to the dimpling on the skin, leading to redness, swelling. Sometimes women think it might be mastitis, they might think it's an insect bite, they might think it's something else. And it does not respond after treatment with antibiotics, steroids, or anything else. And then what you need to have is a biopsy.
Okay, I'm sure, Glenda, I want to address you because you were diagnosed in 2001 and then came back in 2005 as an inflammatory in the same breast. What happened? What did you discover?
I just had a little red spot on my breast, the same breast, and it looked like a bug bite, and then it developed into a rash. Still, I'd never heard of inflammatory breast cancer, so I wasn't concerned or anything. But within a month's time, my breast had doubled in size and was red, had all the characteristics that Dr. Jag just mentioned.
Wow.
And I went to my breast surgeon, and she did a biopsy, and it came back positive.
And doctor, you're shaking your head. This is something that you hear a lot, that all of a sudden it becomes something that they notice but don't address, and then it becomes something that's obvious.
Yes. If anything, they need to address this quickly, because sometimes women tend to think, well, it'll get better with antibiotics, it'll get better if I put some steroids and if I put some cream, or just, or just watch it over time. This is one scenario where it has to be addressed very quickly, because in those 5% of patients who ignore it, it can be life-threatening.
Okay, so we don't ignore it, we get it diagnosed. How is it treated?
Okay, it usually requires combination treatment. That is, it requires chemotherapy, which are drugs which are injected through your bloodstream, radiation, which are energy beams directed to the area, and surgery to eliminate that area from spreading to other parts of the body. After that, you may be placed on certain medications, such as tamoxifen, Herceptin, or Tykerb, which then control the disease over a number of years, depending on what stage it is. All
right. Thank you so much for being here, because awareness is our best source for prevention, so we make sure that we don't end up in trouble. Thank you so much for being here and sharing your story too, Glenda. For more information, call Cancer Treatment Centers of America, 1-800-333-CTCA, or log on to cancercenter.com.